Thanks and welcome to this Sea Ranch Life. Today, we've got a brand new individual here on our Mendonoma coast, Linda Royal. Linda has recently accepted the position as CEO of the Redwood Coast Medical Services. Our previous CEO, Ara Chakrabarty, is taking a much-deserved retirement, and Linda has agreed to join us, and she's starting very soon. Linda, welcome to the Sonoma and Mendocino coast.
Well, thank you, George. I appreciate you taking the time to meet with me.
Thank you for giving some time for our viewers here to learn a little bit about you and everything. Why don't we start off? Why don't you tell us a little bit about your background and your experience? You can mix some of your education there. What have you been doing the
What have
last
I
few
been
years? Yeah.
Well, for the last 15 to 20 years, I've been in the healthcare arena, working primarily with rural healthcare, both in a hospital environment as well as the federally qualified health centers. Currently, I'm the Chief Development Officer at a critical access hospital, and I've been able to help this hospital grow and open up new facilities and pharmacies. And prior to that, I spent 15 years building out community health center and a series of clinics. So that's really been my area that I've loved.
Yeah, and so that's a series of you haven't been at the big giant urban hospitals. You've been at regional or smaller hospitals like what our CMS is here for us. Tell me a little bit about your education. How do you learn to run a hospital?
Well, it's an interesting area. There seems to be education-wise more programs now geared specifically to masters in healthcare administration. I was trained in a large hospital environment. I have my master's degree from Oregon Health Science University and in healthcare administration. And that is predominant to the Oregon area is a wonderful teaching hospital, both in administration and physicians. My undergraduate is in business and social and behavioral sciences, and it's been an area that I've loved working in for many years.
Fantastic. And for our viewers, the Oregon Health Services, that's in Portland, isn't that correct?
Yes, it
Up
is.
up on the hill where all the other hospitals are.
It is the Hill. That is correct.
Yeah, yeah, that's it. Fantastic. Well, what caused you to look at RCMS, or what are your general thoughts about? I know you're brand new, you haven't started the job officially yet, but any thoughts or observations about RCMS here that have occurred to you?
Well, I'm familiar with the Oregon coast. I live on the Oregon coast. I'm about an hour and a half from the California border. But I've also lived in Humboldt County, and I'm familiar with Mendocino County. It's a beautiful area. So geographically, I knew that I wanted to stay in a rural area. I've been away from the federally qualified health center family, yeah, I guess you could say, for a couple of years now. And I knew I wanted to go back into that field. Was very interested in staying rural. That's where my training is. It's where I feel like I could bring value. And the opportunity presented itself from my personal and my professional timing. It was really a good time for me to consider making a change. And I'm very interested to help lead the FQHC commitments to communities forward and had a chance to visit the area and I certainly enjoyed the area and learned a lot about what the need is. It's very similar to what I've worked in.
Yeah. So for our viewers who may not be familiar, because in the healthcare world, there's a lot of jargon and acronyms, but at FQHC, help me here, it's a federally qualified health center,
That is correct.
and
Yes.
that's a federal designation. Is that correct?
Yes, the Bureau of Primary Health Care under the Health Resources Services Administration under our federal government has approximately 10,000 federally qualified health centers all over the United States, both urban and rural.
Wow, that's I had no idea that there were that many. That's a lot of hospitals.
Mhm.
And I help me here again. I've been told, is this correct or not, that FQHCs, obviously they're regulated,
Mhm.
like everything in healthcare is. But I've been told that one of the things you have to, as an FQHC, you have to take any patient, regardless of their ability to pay, regardless of their immigration status, almost anything. Everybody, everybody gets seen when you walk into an HQC. Is that correct?
Yes, that is correct. The clinics were formed in the mid-60s, and the intent after a demonstration project was to ensure that healthcare services were brought closest to those who need it. So whether it was in a large urban area and high-density housing, or in our situations, such as our CMS is in a very rural area, the closer you are to serving the patient in their local community, the better healthcare they can get. So for federally qualified health centers, it really is a very important and a very important designation that the ULALA area can receive is the FQHC funding for RCMS.
Gotcha. Fantastic. Yeah, because RCMS and perhaps Coquille Valley, where you're coming from, is similar. It serves a pretty a lot of geography, but not a big population.
Mhm.
So it's we're here. It's RCMS, or the next hospital is 1.5 to 2 hours away, depending on how you get there. So that's really important. I think we've all realized that if we don't have RCMS, healthcare is just incredibly more difficult for any of us who live here. Yeah.
Well, I think you're correct. And one thing that was very compelling for me, George, was the fact that that RCMS operates in what's called a frontier area, and that is the number of providers to the number of people that live in the community. That ratio is even lower, and so having
Oh,
frontier status is very important. And of course that comes with funding. Not as much as we always think that we need, of course, but making sure that we maintain that FQHC status is absolutely critical.
yeah. RCMS simply couldn't operate unless they were in FQHC.
Mhm.
Yeah, absolutely. Um, have you had? Well, let's kind of dig in a little bit. Any thoughts here? And I realize you haven't jumped in yet. I mean, you haven't even physically arrived here yet. For,
No.
for our viewers, Linda is in Oregon right now, and she'll be here. She'll be here in a little less than a week, and jumping in. But let's talk about the financial. uh, it- And I realize it's a little early for you. The financial position of RCMS, or the financial issues for FQHCs in general. I think most viewers realize that um, in our country right now, healthcare is in somewhat of a crisis situation, and we hear about rural hospitals closing. Every week we hear about something, and it's a critical time. Any thoughts? Any thoughts you want to share there, particularly from a financial point of view, either about RCMS or just about rural hospitals in general?
Maybe if I start more on a global level. So in general, hospitals are funded under much different funding structure than federally qualified health centers. And federally qualified health centers has had bipartisan support from our political leaders at a federal level. I have worked in leadership under FQHCs when we have had various political leadership in place, and the funding has never decreased. So I think that that's really important. A change as we are seeing it right now. If Medicaid decreases or people's access to healthcare under state decreases, federally qualified health centers have tended to remain quite stable in their funding. So I remain optimistic. At the same time, I think it's absolutely critical for FQHCs to ensure that they understand the political landscape and what decisions are moving in the direction of how we get paid. Staying involved, our state membership organizations, being involved with our legislators. I think that RCMS has continued to do a very good job. Ara has always represented the organization with our decision makers. We had a very brief conversation, but it was wonderful to see his involvement at that level.
Yeah, yeah, particularly during the pandemic.
I,
Um, I know Ara jumped in, and I think he got in his car and drove places. My memory may not be correct, but I think he went to actually get COVID vaccines and drive them back because we're remote, and they weren't just going to arrive by magic. And sometimes that happens. But yeah, you're right. And so the connection to the state and to elected officials, you're right. It's really key. And so that's great to hear. Any thoughts? You're giving us a pretty good picture of RCMS right now, and that we're financially in a reasonable place. You expressed optimism. What about the future for our RCMS? Any thoughts there in terms of vision or how RCMS should it grow, can it grow, those kinds of issues.
Well, we know that growth is something that is like a dance. You don't want to grow too fast because you've got to have the operational supports to make sure that the work that you're doing is properly supported. Your staff have to be educated. But I think what growth will happen is really driven by the community. I've read the community health needs assessment. It's very well written. It's very well conducted by our CMS. They conduct a needs assessment every 3 years, and growth is really driven by what does the community need. Now, that doesn't
Mm,
necessarily mean growth being a building, but it's a combination of do you have the sites in the locations to serve the communities that need the help? And what kind of services are you providing? And does that meet the community need? So I think as I look at the community health assessment that was recently conducted, I think our CMS is doing a good job in responding to those needs with their dental services, behavioral health, primary care services. I see us continuing that. Where I see critical is the urgent care. Because of the fact that there is not a local hospital,
right.
stabilization and transportation is going to continue to be a critical element of the business model for our CMS and having
Yeah,
those providers that are educated and trained.
to do that. For our viewers who, and maybe I don't know the precise definition, give me a quick understanding of the difference between primary care and urgent care.
Very good
What
question. Very
Those are
good
two
question.
different things, I think, or they're related but different.
And I think we use the term urgent care in a way that what is our need? Urgent care can be a certified urgent care center. RCMS is stabilization and transportation to transport patients to the next level of care, being a hospital,
Okay.
from what my understanding has been. And I think that primary care services are routine foundational medical services that one should be receiving on a regular basis.
Right.
If you're receiving those primary care services, you're taking care of your health on a regular basis so that you're not going in to see a provider when you're very sick. And especially with an aging population, the demographics of that
Hmm.
community, the region tends to be an older population. It's more of an internal medicine practice, making sure that patients are getting their health screenings, getting their mammograms, getting their colon cancer screening, vaccinations, all of the preventative things to be well is really
Right.
preventative care.
Yeah. Thank you. That's really good. It occurred to me. It's kind of like having a car. You can change the oil when you're supposed to do it. You can have the scheduled service thing, or you can wait till your car makes a funny sound and then you rush into a mechanic and say what's wrong. Um, so it's better to be proactive. I think
Mhm.
is what you're telling
In
us. And pro
healthcare, that's absolutely what you want. Absolutely.
Yeah, yeah, for sure. Talk to me about some of the challenges. Uh, Once again, be this RCMS or an FQHC or a rural hospital, what are some of the challenges that you've faced in your career? And are any of those challenges, do you expect those to be present here at RCMS?
Well, I think one of the most important foundational uh, challenges that I think a board has, the organization has, is ensuring a strong board. I've
Hmm.
had the pleasure of meeting most of the board members. What I've seen is a very engaged board of directors, very knowledgeable on the need of the community, very involved in the community, and very driven to be able to serve the community. So I think there are organizations that don't always have that. And I think somebody coming in as myself and for Aura to be able to have that support is very important. Staffing, education for the staff, ongoing education for existing staff is challenging. But one of the things that COVID did bring us was you and I meeting like this today, being able to have
Right.
education remotely and bring in training and experience is being able to use technology. And I think that's a very positive thing that's helping remote communities. But recruitment and retention and the cost of doing business, supplies have gone up, medical supplies have gone up,
Mm.
the
Yeah.
cost of medications go up. So I think being able to be financially sound and understand your operations very well, understand your bottom line is critical. Those
Yeah.
are unlike any other FQHC, any other
Yeah.
health.
Yeah, yeah, same thing. Talk to me a little bit about development because you're coming from a role as a development officer and why that's important. Yeah, give me a quick definition of development for our viewers. What does it mean when your current position is Chief Development Officer? What does that mean?
Well, thank you for that question. So Chief Development Officers, Chief Strategy Officer are very similar. My focus over the last 3 years has been focusing on building out services and
Mhm.
access to healthcare services in the community. In the area that I've lived in and worked in for a long time, I know the need for the community. And so how do we hire the right people with the right skill sets to provide the services the community needs, building out new clinics, opening up new pharmacies. That has been my focus for the last 3 years.
Yeah, yeah. And all of that, no surprise here, all of that takes money. Like everything else in life. And I realize we get federal money, we get state money, insurance covers some of the cost of services. Um, but yet, most of us here remember a few years ago when we had a major fundraising drive because our CMS was really on the brink.
Mhm.
Talk a little bit about the fundraising efforts to fill in what the federal or state or what other sources don't fill in and how does that fit into the picture?
No, I think that that's an essential part of an operation, any nonprofit. The positive is when you have a clinical environment like RCMS, you can generate a level of revenue from the services that you provide.
Right?
Private insurance doesn't always pay a reimbursement rate that covers the cost of your services, whether it be
Correct.
overhead and your staffing, your
Yeah.
storage, your medical expenses. Um, Good, well-run FQHCs generally have about 30 to 35% of their revenue comes from their federal grant, their funding. Uh,
Okay.
then you supplement that with your operational revenue that you generate. And then there's a portion that really is the community investment. And that's a critical part of funding for a federally qualified health center or rural health center is how is the community engaged in supporting the services? It's a critical element of helping a community be strong as if you have strong primary healthcare services it helps people stay in their homes as they age. And so ensuring that RCMS responds to the community's need and that the community trusts RCMS and
Mm.
trusts the work and the services being provided and are willing to step forward financially in supporting the work of RCMS is very critical. I've spent quite a bit of time talking with the board about this.
Yeah, yeah, you're right. That really is, I think the good news, a piece of good news for you is we as a community faced that situation about 6 years ago, and I don't think any of us have forgotten that. So there's a strong swell of support uh, from financially from the community back to our RCMS. We know how important it is. Hey, I wanted to back up. You mentioned recruitment and retention and you're talking about staff, and these are all healthcare positions, and uh, it- that's challenging in a rural location like ours, isn't it?
Well, it is, and I think that's not unlike any other rural community, whether it's a hospital, whether it's a behavioral health center.
Right.
Having the ability to show professionals what your community offers is critical. I've spent a lot of time working on not just recruitment, but also retention. If a community has great staff, whether it be licensed professionals or critical support staff or clinical support staff, we have to keep those people and we
Yeah.
have to make sure they're trained and they're educated and they're happy and we are a great place to work. I worked really hard at that. That's a very important value to me is how do I take care of the staff so that the
Mm.
staff can take care of patients. There are great programs that are offered, such as loan forgiveness, scholarships, and RCMS qualifies for all of those. And I believe
Oh.
many of them in place already.
Oh, wow. Okay. I didn't know that. That's fantastic. So you've got a toolbox that you can reach for in terms of recruiting and retaining qualified staff. Uh, but it's always a challenge,
Mhm.
to some
It
degree
is.
or
I think
another.
one of the things RCMS has just, I've learned and had the chance to speak with her is RCMS has a new HR director who has spent many years, I think at least a decade, working in federally qualified health centers in California, in rural communities. And I'm just thrilled. I really am looking forward to working with Laura because she's got the toolbox.
Ah, that's fantastic. That's fantastic. Um, a little bit about the future, maybe, of RCMS. I'm going to say a year or a year and a half ago, the board unveiled a vision for some expanded uh, physical facilities and an expansion building, which I would term. It appears that it's needed, but it's a modest step. It's a modest piece of growth. We're not talking about, you know, it's not a gold-plated, gigantic thing at all. But anyone who receives services at RCMS, you realize that from a space standpoint and from optimizing the use of that space, it's needed. It's not an ideal spatially setting for everything. So we need. Do you want to talk about that? Have you given that any thought? And maybe you've seen some of the expansion plans. Admittedly, those are out there in the future. Um, Care to share any thoughts there?
I've seen a little bit. I've
Okay.
heard a little bit, and it's one area that was very compelling for me. I think my biggest joy is to be able to watch facilities open and be part of that. I've done construction from the ground up and renovation from the ground up in facilities, and the greatest joy is to watch patients go in a facility after you've renovated or you built it, and you have a facility that is open to the community, that is more accessible, that the providers are excited to come to work, they have good space. And so I think there's work to be done.
Yeah.
I'm excited to see what we are able to build out, not only to support primary care services, but also to support what is needed for urgent care. And I think the board and ARA is headed down a good path. They've started the process, and I'm looking forward to jumping in.
Fantastic.
Yeah.
Well, Linda, you've given us a lot to think about, and obviously you've given us a lot of thought. And we're just going to be thrilled to have you in our coastal region, as opposed from Oregon. Although the Oregon coast is every bit as beautiful as California, in my opinion. Um, any last thoughts that you'd care to leave, or anything you'd like to say to our viewers?
Well, thank you again for having me. I'm very much looking forward to just getting to the community. I really have an open door policy. I want to get to know the community. It's the only way that I'm going to be able to do the work that I'm tasked to do. And I look forward to working with the staff. There's some very talented, very passionate staff that I had the opportunity to meet. So come Monday morning, I will be boots on the ground and look forward to getting to work. Really,
Eh,
thank you.
Fantastic. We've been talking with Linda Royal. Linda is the incoming CEO, and in less than a week, she'll be, as she just said, boots on the ground at RCMS. We're thrilled to have you, Linda.